your new urgent and emergency care department. To help keep up with the growing demand on our emergency services, Chesterfield Royal Hospital is investing £24 million to build a new urgent and emergency care department on our site. As a trust, we provide care and treatment to a population of more than 400,000 people across North Derbyshire, seeing upwards of 90,000 patients in our emergency department per year, a figure that is rising annually. Linking up with our health partners across the region, we're committed to ensuring that we do our very best to encourage these patients to access the right services at the right place at the right time. This building will help us to do that more effectively. Built on an existing staff car park with spaces relocated elsewhere in the trust, it's been designed with support and input from our clinical teams and our DSFS partners. The department will have a spacious reception area here, where patients can be streamed to the appropriate point of care with dedicated separate areas for minor injuries and urgent treatment, paediatric patients, a dedicated area for patients arriving by ambulance, those presenting with major injuries and emergencies, and an area for resus. Patients will ring NHS 111 first to ensure they're coming to the right place for the most appropriate treatment. They will book patients' dedicated time slots to minimise waiting times. One of our receptionists will then take our patients' details and direct them to the waiting area. Patients who have not contacted NHS 111 will be assessed in our streaming area to determine the most appropriate service based on clinical need, be it in our urgent treatment centre, pharmacy, or even alternative NHS services outside of the trust. If you bring a child in for treatment, you will immediately be sent through to our dedicated paediatric area. Reducing anxiety in our younger patients is important to us, so we will create a more relaxing environment away from adult areas that can feel noisy and overwhelming for children. Our paediatric area will look and feel different to the rest of the department, with a non-clinical feel, including decoration and artwork that children will find engaging and distracting. Paediatrics will also contain a wait and play area, themed consulting rooms with plenty of space for children and parents, and a dedicated room for child and adolescent mental health support. Adults may be streamed to our urgent treatment centre, which will be for illness and injuries not considered to be an emergency. Again, the design has factored in plenty of room for you to wait in comfort, with spacious treatment areas to ensure suitable access for everyone. This area is essential to our plans by helping us to divert patients with less serious conditions away from our more critical services, saving patients time and enabling our critical teams to focus on emergencies. Those with more serious conditions will be streamed to majors. This area is larger with more cubicles to help cope with higher demand, including some specialist areas for gynecology and bariatric patients. Our nursing station is right in the middle, allowing them line of sight throughout the department to improve communication between our staff and patients and also security. It's situated to the right of the building as you enter, perfectly placed for our ambulance patients who will come in through the rear of the building and next to our resus bays for faster access. We have also built and designed the department to provide mental health support, a close proximity to therapy services and diagnostic imaging, and a clear and quick route back to the main building for patients who need to be admitted. We are incredibly proud to be able to introduce this new facility to you, created with involvement from our Joined Up Care Derbyshire partners and due to open in late spring to early summer 2023. By providing more space, more capacity and the ability to extend further, this building will protect our emergency and urgent care services for many years to come.